First, ensure there is a soft towel under your working area. This will protect the lens from any damage if it is dropped. When inserting and removing, you will have the best success in a seated position. After removing the lens from its case, place it on top of your fingers or a plunger. When placing the lens on your chosen holder, ensure it is in a relatively balanced position and not tilted to one side. Fill the lens with non-preserved saline. This comes in small vials. Avoid the large saline bottles. Even though they are cheaper, the saline will be in contact with your eye for hours at a time, and preservatives will cause problems. Fill the contact until it has a large meniscus. It is important that the saline is almost overflowing before every insertion. If there isn't enough saline, there is risk the lens will sit too close to the eye. When inserting a scleral lens, the eye needs to be parallel to the ground. The lens will be held in one hand and the other hand will hold the eyelids. It is easiest to use the outside hand to pin the eyelids, so for the left eye, you would use the left hand. This avoids the nose while holding the eyelids. Using the side of the pointer finger, place it at the base of the top eyelashes and the side of the thumb place at the bottom eyelashes. Once placed on the base of the eyelashes, use the finger and thumb to pull the top and bottom eyelids just wide enough so the white of the eye is visible. Then use backwards pressure to pin the eyelashes. If you keep pulling the fingers apart, you will slip off the eyelashes. And if the fingers do not have your eyelashes pinned, a successful insertion will be very unlikely. The lens cannot be forced into the eye. It needs to be inserted gently without touching the eyelids. A forceful insertion or a knock on the eyelid will affect the way the lens fits on the eye. After tucking the chin with the eyelashes pinned, with a slow and steady pace, guide the lens up towards the eye. You'll feel the saline touch the eye. The lens is then guided up towards the eye slightly further. Some saline will be displaced as the lens edges need to be placed gently onto the eye. Try to avoid feeling pressure on the eye, as this means the lens has been placed too close, dispersing too much saline. It is critical to look straight down and into the lens. Sometimes having a point of interest on the towel can assist. If the eye looks away and back down during the insertion process, air bubbles can form beneath the lens. Large air bubbles will be obvious as they will interfere with your vision. A small bubble may only be visible if you look at the eye in a mirror. If you see any air bubbles, you need to remove the lens and reinsert. Another common difficulty is the centering of the lens on its way up into the eye. If the lens is off center, it will hit the top or bottom eyelid. It may be helpful to have someone sit on the side of you to get the feedback and learn whether your tendency is to place it too close to the top or bottom eyelid. To remove a scleral lens, you can use a plunger or your eyelids. To remove the lens with a plunger, it needs to create a seal to suction onto the contact lens. Squeeze the air from the plunger. Keeping the squeeze, place it onto the contact lens. Let go of the air and check for suction. The plunger will remain in place if suction was successful. It is important to place the plunger on the bottom half of the contact lens. If the plunger is placed on the middle, the pull of the scleral lens from the eye will place it under a lot of force. By placing the plunger onto the bottom half of the lens and utilizing a lifting action, it reduces the force required to break the seal. It is helpful to use the free hand to pull the bottom eyelid out of the way and a mirror to assist in seeing the edge of the lens. Trouble with attaining suction may be due to the plunger being placed too low or not having the angle of the plunger match the angle of the contact lens. The eyelid method removes the scleral lens by manipulating the top and bottom eyelids underneath the lens edges. Using the pointer finger on one hand, pull it up to the top of the lens edge and then place backwards pressure. This acts as a stopper to prevent the lens sliding up when the bottom lid is manipulated. Using the pointer finger of the other hand, place it at the base of the eyelashes on the bottom lid. Pull the bottom eyelid down over the edge of the contact lens. Then apply backwards pressure before pushing the eyelid up to catch the bottom edge of the contact. The most common issue here is pulling the eyelids too wide apart so that the inside of the eyelid is visible. If this happens, the eyelid cannot catch the edge of the lens. It is vital to the successful removal of this method to use the lid margin to get underneath the lens edge. The lid margin is the apex of the eyelid, just behind where the eyelashes grow from. If you see the inside of the eyelid, reset the hands on the eyelids and remember to apply backwards pressure. Another common issue is if the fingers are not placed right at the edge of the eyelids, it is more difficult to perform the manipulation. If the eyelid doesn't have enough pressure or isn't at the lens edge, as the bottom lid is manipulated, more force will be required to break the seal, as the lens can move around